Assalamualaikum and very good day everyone. My name is Nur Misha. Together with my group members Nur Farhan, Nur Shania, Nur Amira, Nurin Shakina and Nur Najiha from Group D, and today we are going to present a disease named vertigo. So in this video, we are going to talk about what is vertigo, what are the symptoms, what are the causes, what are the effects, and lastly, the treatment or cure for vertigo. So what is vertigo? Vertigo is the sensation that you feel as if you or your surroundings are moving or spinning. It is a type of neurological disease and it is caused by your senses telling your brain that your body is off balance, but actually it isn't. Attacks of vertigo can occur suddenly and last for a few seconds, or they may last much longer. For severe vertigo, the symptoms may be constant and last for several days and making your normal life very difficult. So, you must be curious on how does it feels like to have vertigo, right? So, we prepared a video, a simulation video on how a person feels when she or he have vertigo. So, as you can see in the video, the person will feel like her environment is spinning or moving, but actually it isn't. The person himself also does not moving, but the person feels like this.
Next, move on to the symptoms of vertigo. Vertigo is often triggered by a change in the position of your head. People with vertigo typically describe as a feeling like unbalanced, swaying, tilting, or pull one direction. These symptoms can be present even when someone is perfectly still. Movement of your head or the body, like rolling over the bed, can be worsen more the symptom. Next are the symptoms that may accompany the vertigo, such as vomiting, sweating, jerking eye movements, headache, and nausea. These symptoms can last a few minutes to a few hours or more, and they may come and go.
Now I'm going to explain about the causes of the vertigo. Vertigo is usually caused by the inner ear problem, which are BPPV, Meniere's disease, and vestibular neuritis. So here I'm going to explain further about BPPV. BPPV is stand for benign paroxysmal positional vertigo. BPPV occurs when tiny calcium particles are dislodged from the normal location and migrate into the semicircular canals where they are not supposed to be. These particles will collide in the canals and they will interfere the canals that are used to sense the head motion, causing the inner ear to send false signals to the brain. Then the Meniere's disease is caused by the build-up of fluid and changing of pressure in the ear. The excess fluid causes swelling and pressure. The swelling will distort the balance, sound, and the information travels to the brain. It also can cause the repetition of the vertigo, along with ringing in the ear and hearing loss. Lastly, the vestibular neuritis is usually related to the infection that are caused by the virus. The infection will cause the inflammation in inner ear around the nerve that are important for helping the body sense balance.
We are going to discuss the effects of vertigo. Previous slide have explained about causes of vertigo, so it is related to the effects of vertigo. So firstly, the patient of vertigo will feel dizziness because inner ear disorders frequently cause of feeling dizzy. The most common causes vertigo, Meniere's syndrome and ear infections. Secondly, headache. Vertigo is commonly caused by a problem with the way balance works in the inner ear. Certain head movements trigger vertigo. Then, thirdly, imbalance. They are often caused by disturbance of the inner ear. Number 4, sense of spinning. People with vertigo will feel as though they are actually spinning or moving, or that the world is spinning around them. But actually, they are not spinning because they feel like that because their view is like spinning. Then number 5, fatigue. Patients with vertigo often complain about fatigue during a vertigo attack.
So how do we treat or how do we cure vertigo? Apparently, the treatment needed depends on what causes the vertigo. And in many cases, vertigo can disappear without any kind of treatment because our brain can adapt to maintain our body balance. So the first method is vestibular rehabilitation, or in short, vestibular rehab. So this is an exercise-based program, which means that the patient does not require assist from professionals and the exercise can be done by themselves at home. So what is the vestibular system? So the vestibular system sends signals to our brain about head and body movement related to gravity. So for instance, if someone is about to fall, our vestibular system will send the signals to our brain saying that someone is about to fall. So the second method is the canalith repositioning maneuvers, or CRM. This method is used to cure vertigo, which is caused by BPPV, or benign paroxysmal positional vertigo. As mentioned before, BPPV is when calcium particles accumulates in our ear. So the main aim for this method is to move the calcium deposits out from our canal into our ear chamber, so eventually the calcium particles will be absorbed by our body. The third method to cure vertigo is surgery. Surgery is needed when the patient's condition is critical. For example, if the vertigo is caused by tumor or injury in the brain. So surgery is needed to be conducted on the patient. And the last cure for vertigo is medicine. Medicine is prescribed to the patient if the patient experiences symptoms such as nausea or motion sickness. Medicines such as antibiotics or steroids are given to the patient for infection or inflammation that occurs in the ear of the patient. The first method, vestibular rehab.
Your head still. Look up and down. Look side to side. Hold a finger out at arm's length. Focus on your finger and bring it toward your nose. Then back out again. Move your head up and down, then side to side with eyes open. Repeat with eyes closed. Hold an object in front. Turn head 45 degrees to left and right while keeping eyes focused on the object. Sit on edge of bed. Flip body to left. Return to sitting position. Flip body to right. Place an object on the floor in front of you. Reach down to pick it up. Then return to an upright position. Bend forwards to pick up object from floor. Turn to left to place object behind you. Turn to right to pick up object. Get up from sitting position. Turn 360 degrees to left and sit down. Repeat with the right side. From standing, bend forward to touch floor and return to standing. While standing, make sudden 90-degree turns with eyes open, then closed. Stand on one foot with eyes open, then closed. Start hopping on left foot, then right. Roll head, then whole body from side to side. While walking, look side to side. Walk heel toe, with eyes open and closed. Forwards and backwards. Side-stepping walk.
Okay guys, now that we have discussed and you have learned all about vertigo, you should be very grateful for it. It is important for people, especially us science students, to know about vertigo. At least you should know what are the symptoms and the cure or treatment to treat this vertigo. By having the knowledge of a vertigo, you could be someone's savior, because you can, when you know that when the people is experiencing the symptoms, you can tell them that they are having a vertigo, and you can tell them what are the treatment that they should do to treat this vertigo. And since this vertigo is not a common disease among our society, so someone might experience it, someone who has experienced it or will experience it, they will do not know actually they are having a vertigo. So when you have the knowledge, you can tell them that they're actually having a vertigo. But the most important thing is you should never underestimate or take your dizziness lightly. If you have any of the symptoms or any of your friends or family have the symptoms, you can ask them to seek the doctor, because the doctor knows better and the doctor will help and guide you to treat and cure this disease. That is all from us. Thank you so much.